Hello and welcome back to my channel. This is day 7 of a 10-day self-challenge to launch 10 videos related to diabetes management and care. Today's video, number 7, I am going to discuss 3 tests that are done to confirm diagnosis of diabetes. Again, my name is Maureen Sullivan. I'm a registered nurse, certified diabetic educator. My website, which has tremendous amount of blog entries on it regarding all facets of diabetes management, MaureenSullivanRN.com. So I hope you'll check that out. But today's video, the top 3 tests that are done to confirm diagnosis of diabetes. Number 1 is called a random glucose test. The results are anything over 200 milligrams. So that's the first number I want you to know is 200. It is a random test, meaning you're at a clinic, you're at a doctor's office, they check your blood, it's over 200. It is strongly suggestive that you may have a diabetic situation or a hyperglycemic situation and they're not sure why yet. That in and of itself, it should warrant additional testing. Number 2 is a little more scheduled and thought-provoking in terms of how it's done. It's a fasting blood sugar, meaning you should fast for probably about 8 hours before you have the blood test. So none of those late night or middle of the night snacks here. And the test that parameter is 126 milligrams per deciliter. So that cut point, if you will, is 126. If you remember previous videos, 100 to 125 is pre-diabetic, and below 100 is considered a normal fasting blood sugar. If you are having that test done and it is above 126, it is strongly suggested that you have it done at least twice, because if you could just imagine the situation, a single test like that could be affected by many things that you've eaten the night before, especially if you eat later in the night before you go to sleep. So again, fasting blood sugar, the cut point, if you will, 126 milligrams per deciliter. The last test I wanted to go over, kind of the gold standard, and I'm going to do a separate video on this tomorrow to kind of deep dive into the intricacies of this test, but it's called the Hemoglobin A1C test. It can be done randomly, meaning you do not have to fast for a period of time beforehand. It can be done any time of the day for that reason. It can be done just on, unscheduled in terms of you're at a clinic and that, or a doctor's visit and they decide to add that on to lab testing. The cut point, the parameter that you're looking at is anything over 6.5. So again, 6.5, they consider that a confirmation of a diabetic situation or a medical condition being diagnosed. The parameter of 6.5, if you remember on a previous video, pre-diabetes was 5.7 to 6.4, and normal A1C levels are below 5.7. So very simple numbers here, over 126 for fasting, over 200 for a random glucose test, and over 6.5% for a hemoglobin A1C. Tomorrow, like I said, I am going to do a deep dive, just a dedicated video on a hemoglobin A1C, because that is used more frequently, and I wanted to explain the uniqueness of that test when compared to the other 2. So in the meantime, drop me a comment. Let me know what types of videos you're interested in for chronic disease management with a focus on diabetes or pre-diabetes. Check out my website. Again, shameless self-promotion, MaureenSullivanRN.com. Thanks for tuning in, and I will see you tomorrow. Have a great day. Bye.